Seattle, and how are you handling all of this?
Great question. If I were to say this diplomatically, I would probably say something different than what I'm about to say. But right now, from what it feels like to me, in terms of what I'm seeing, as I'm a licensed mental health counselor by trade, but I also have my licensure as a nurse. So I'm getting all of the updates in real time. So I get an update every day. So I get to hear on boots on the ground what's happening. Plus I have friends who are still practitioners who are seeing patients, and they're out there, boots on the ground. So between that, what I'm going to say is more what you would expect, which is a train wreck here. It's just a train wreck. And part of the reason was because not only did we have the first case in the US come to like 5 miles from my house, but we didn't have testing kits. Testing got delayed 7 weeks, actually 7.5 weeks. There's still people who can't get testing now. It's been 7.5 weeks since day 0 with patient 0 on January 21st of this year. We still don't have the PPEs, which is the personal protective equipment that practitioners need to be wearing in order to give the test. So even as the tests are rolling out to different places, they don't have the protective gear to actually administer the test. So for example, and for privacy, I'm not going to name who it was, but I sent off a friend to go and get somebody else tested because nobody knows where to go. And I just happened to hear, because of what I do, that there was testing available and there were protective gear. So there were people ready to do the test. There was no line, no wait. And this should have happened a long time ago. So what's happening here is that we have very suppressed numbers, is my suspicion. So for example, March 10th, I had to write this down. There were 74 new cases announced, so that the total went up to 190 positive cases for COVID and 22 deaths. Also on March 10th was the day that our governor banned any events larger than 250 people. So concerts, sporting events, those kinds of things will all be canceled. In 2 days' time, the updates started slowly rolling in. 267 cases instead of 190, and 2 more deaths. So again, assuming that the testing, because it's been so delayed, we're going to have basically a big bump either by the end of the weekend because more people are getting testing, or those who already got sick and they're past the point of needing to be tested. We won't really know what those numbers are, but we know that they're a lot higher than what we have. And so again, this train wreck, because it's so hard now to track and trace all the positives out there and where they went. We went from having 1 life care center, 1 nursing home facility, having most of the cases all in one place. Now we have 13. 3 of them are in my neighborhood within 4 miles of my home. 1 of them is within a half mile. This is how close it is. And now it's not numbers out there, it's numbers within here, it's people. And so as I've been just dealing with some of the cavalier responses, and I know some of it's projection, people are scared, so they make light of it and say it's not a big deal, it's just like the flu, which by the way is a piece of misinformation. I've just calmly have said to people, out of consideration and respect for the families who are struggling and for their loved ones who have either died or are in the process of dying right now because of this, I would ask for you to allow them to bury their dead and let them grieve. And that has plummeted, at least in my communities, has really plummeted that cavalier sort of non-response attitude that I've been seeing. So yes, it feels like a train wreck. Today, the WHO just declared it a global pandemic, which is like, wow, January. I already thought it should have been, but because we didn't have the numbers yet, really couldn't do it. Now, what I predicted and what others who are in the healthcare industry predicted is here. Maybe should have been declared earlier.
So, Ime, tell me exactly where it's located in Seattle. Is it the whole entire city of Seattle? Is it a section of the city?
The way our county, King County, is treating this is they're not treating it as like just sections, because the way that viruses can spread, it isn't going to stay contained in one area. So when the first case came, it was actually north from Seattle, which is like a 30-minute drive on the freeway. And that's pretty significantly far. So that was Snohomish County. I'm in King County, which is a county south of Snohomish. They call it basically Snohomish County sort of the Seattle of the North. So they're not very far away. But now it's moved onto the east side, which is the neighborhood that I live in. It's not where I am right now, but it's where I live. And it's moved into the greater part of King County, now in Seattle, but a good amount is on the east side, still north, and moving into other parts of Seattle. So it is spreading. They can no longer say it's just in one community or two communities. Currently, King County has just gotten, I believe they got permission to purchase a small hotel in order to put people into for quarantining, because they're anticipating that if we have to move from what's considered a level 2 response, which is level 2 is to ask people to socially distance themselves during this time. And then if they're sick, if they have symptoms, to self-isolate. So it's not being enforced, but they're being asked to self-isolate. That's level 2. Level 3 could include mandates and injunctions to basically say, if you have these symptoms, you must stay away from the public. You must self-isolate, and that is to prevent it from spreading even further. Then that can have a legal injunction in there. We are not there yet, but it's possible it could go there if, again, these numbers get bigger. So I sat in on a phone call with one of our city council people and also a public health representative to have a discussion about what they kind of see happening yet. And she discussed these things. Her anticipation, the public health representative was saying that we're about to see a bigger influx of numbers go up because of the delay in testing. When that happens, they'll have to make, of course, an assessment of whether or not we have bumped up to level 3. So we're right in between there.
Yeah, and it seems like it's just getting worse throughout the country. It's not just Seattle, it's crept onto nearly most of the states around the country, including New York. New York, we're really starting to feel it with New Rochelle being on lockdown right now. So my question to you is, what's scary about this whole thing is that people may have the virus, but don't know that they have the virus, and they're walking around infecting people. Is just hand washing really the answer to that?
Surprisingly, it is a really great defense, along with if they had symptoms and they've been reading the guidelines, it's been everywhere in the news. I don't think there's a single person who hasn't heard about what to do in every single language that we put it out there. So it's really available in all the major languages for anyone to have been able to see. And people are doing a pretty good job in spreading the news about this. So it had been a choice at this point to say, look, if I have these symptoms, I'm going to choose to self-isolate. And what you'd want to do is follow the guidelines from your public health. Ours is saying, look, if you have these symptoms and you break a fever, from the moment that your fever is broken, you need to wait at least 72 hours and become asymptomatic before you're going to go outside of the room you're isolating in. And even then, you'll want to choose for up to 14 days to stay away from other people. there are two reasons why. One, you don't want to spread it to other people. But so that 72-hour should ensure at least that you wouldn't spread it to someone else if you've been asymptomatic. But the other part, and this is what a lot of people are not thinking clearly about, is that what is this virus? It isn't the flu. It comes on you like a Mack truck. You will feel like you got run over and then run over again. And as soon as you feel better, most people want to get out of their room that they've been self-isolating, eating awful food, and go out about their business. But then that's when you're also very vulnerable to secondary infections. So now we're talking about bronchitis, pneumonia, just another cold or another flu coming on its heels and just going, gotcha. And so what we're seeing also here, and I don't have any numbers because most people aren't going to be reporting this. It's just I've been hearing it just from stories from other people, is that they had something that felt like a flu some time ago. And then now they're all sick with a secondary infection. They're starting to put it together. Oh, that other thing I had, that was probably COVID. And now I've got a secondary infection.
It also seems to me that you could, it seems like the literature is saying that you could actually get COVID once you have it, you could get it again. It's not like
Yes,
you're immune to it, right?
right, because we don't have built immunity to it. That is correct. And so that is why we've got researchers working, they've been working to develop a vaccine, but it will not be available for minimally, like 8 months from now. And then just like the flu vaccine, they'll have to watch and monitor to adjust it for every season, because now that it's, and this is the difference between the word pandemic, epidemic, and endemic. It's endemic to our communities now. We can't expect, because it's in the wild, that to see it. It's not going to necessarily just go away. So we do need to develop this vaccine. It's being tested, but it won't be available until further down the road.
Now, in New Rochelle, it really started with one guy who was a lawyer who commuted to Manhattan every day. And, he was an Orthodox Jew, and he had a synagogue and went to a wedding. And that's how it became, from one guy, like over 100 people got infected.
Shaking a lot of hands.
Is,
Mm-hmm.
is, is that the same thing that happened in Seattle with one person getting it and it just kind of going haywire? Or they don't know at this
Probably
point?
that's the most likely scenario. If you even think about, for example, a hospital, and this is why it kind of gets in the news if you hear about a hospital that had a problem with, say, either their air filtration system or their cleaning, is that it's very easy to transmit what are called nosocomial infections. So one person, say, has pneumonia, you've got to clean that room very carefully, because you've got sick people in a small environment that's enclosed. So where does that virus have to go? Unless you do a deep cleanse of everything, it goes into the air filtration system. Unless you have a good air filtration system, you can basically spread it everywhere. And so that's a very likely scenario that it went to, for example, to healthcare workers. So that is what happened at the Life Care Center, this nursing home. Once patients got it there, the responders and the healthcare people were also all exposed. And depending on whether or not their gear worked, depending on whether or not they used it correctly every single time, or they brought it home with them, some people did get sick.
It's
And then it just goes on and on and on.
very scary, especially in these assisted living or nursing home facilities. I mean, it seems like it's spreading, and I'm just not sure if there's anything that they could do about this. But what I want to know from you is the federal government doing anything in Seattle to, besides testing? I don't even know. Are they doing testing at this point to everyone, or how's that going?
So if you look on our public health, our King County Public Health page, on the uh, Washington Nurses Commission, that's in conjunction with King County CDC recommendations, everything is saying that there might be reasons why you don't need to be tested. And up until just a couple of days ago, it was very unclear where you could get testing if you needed it. It had to be only done by a doctor's orders. And for the most part, if you called in and said, I think I need to get tested, you were told, no, you don't need to be tested unless you are short of breath and you need to come into the hospital. There, a doctor will make a determination if you needed to be tested. Now that's slowly changing because the tests are rolling out. There are at least 2 places that I know of in the Seattle area that you can get testing at. One of them, though, is only restricting it to their own patients and students, and that is, I believe that's the University of Washington Medical Center. So they're not allowing everybody to just come and flood in. They're saying their admin, their students, their staff, and any member of the UW medical system. And I just sent somebody else, as I mentioned, to this other hospital that I knew of that had tests available. I currently do not know where else the tests are going. So this is very slow going. It's crazy because I did know of a healthcare practitioner who was unable to get a test, and he was very sick. Now, he should have been given the test immediately because he's a healthcare practitioner and he can't go back to work and actually help people unless he knows whether or not he has the virus.
It seems like countries around the world, China, Italy, etc., they're all testing people, thousands of tests a day.
Yeah.
And why do you think what is the holdup here? I mean, we're supposed to be the most advanced culture. What's the holdup?
So, I'm going to take a hit here for my city. I don't think Seattle had the best response in place when it happened. We were the first to get hit. We were caught unawares. I am hoping that every other large, densely populated city in the US is paying attention and vowing to not reproduce what happened here. Now, to the credit of all the hardworking healthcare professionals and the public health professionals who have scrambled ever since, I applaud them that since then they have gotten on the ball. They have been working tirelessly. Funding has been appropriated. Even Bill Gates, who lives within our state, and I pass by his house and sometimes I wave at it, from the freeway. Hi, Bill Gates. His foundation put together, funding for home test kits that could be mailed to people's houses, and that is being readied as we speak. I believe over 1 million of them. So it's coming. We were late in the game. That delay has caused problems, not just for us as a state, but I believe for our neighboring states. We share a lot of commerce and commute across other states. We are not an island. And so, who knows how, say, Oregon got their first cases, but Portland now has them. Well, Seattle to Portland is a very popular exchange. Who knows if that was the way that it got in there, or through the airports. So I want to say positive, strong things for our government officials who have been working very carefully to try to get the news out, to tell people what to do. Where I'm most disappointed in is, of course, the delayed response, but that's now in the past. Can't do anything about that. The other thing I'm disappointed in is that there's still a lot of people, as you say, walking around just going, it's just like the flu. I'm not going to do anything different. It's going to get me. It's going to get me, without thinking about the bigger picture.
Right. Exactly. So I want to ask you 2 more questions. One, in terms of anxiety. All right. So people are walking around
very, very anxious. I'm sure you're seeing that all over Seattle. Um, what can you do?
It may seem like a very small thing, but to ask somebody to, and you'll notice that I'm doing it right now. Did you notice how I slow down my speech? I get people to slow down for a moment. And then I watch what they're doing with their body. And if they're holding their breath because they're either breathing very shallowly or because of that anxiety, they're not breathing well, I'll just say, hey, breathe, breathe. I'm doing a lot of that virtually. I'm doing that with my own clients. I'm doing that with friends as we talk. I'll say, remind them, hey, take a breath. And then the next thing I'll say is, tell me what you have taken control of today. And they'll rattle off and I'll say, wow, that's a lot. So you're covering and doing everything you know to be responsible for yourself, for the people you love, for your community. That's fantastic. Keep it up and just give, a nice encouragement there. And then they'll say, but what if this and what if that? And I'll just say, you know what? One step at a time, control what you can, turn down the volume of all the other stuff, turn it down for a moment, just control what you can first. Take care of you and your loved ones first, then your community. Look out for your neighbors. Do something positive. So in my neighborhood, we have a housing association website, and I put a post on there and said, just checking on everyone, and I want to check on you all again within this many days. If there's anyone among you who's living alone or struggling and would like to have food, medicine, or anything delivered to your home on your doorstep, yes, we have Amazon. Yes, they are overrun. But if you need anything, reach out so that we can help you. We want to know, and we will keep your life private, but we want to know if you're struggling so we can help. One that gives us all an opportunity to help one another. What feels less helpless than actually taking an action and helping, right? That'll make
Absolutely.
that anxiety go down as we realize I am doing all I can. I'm taking as much control as is available to me. And you can just feel that just come down. I'm seeing you smile, so you know what I'm talking about,
I
right?
do. I absolutely do. So,
Yeah.
do you have anything else that you'd like to share with the community?
Probably the most frequently asked question I'm getting is after people have taken care of the surface things. They've gotten disinfectant, they've got, their hand sanitizer, and they're washing their hands, they're maybe self-isolating or socially distancing. So they're doing all the things, and so far they're well. The next question they ask, is there anything that they could do to help boost their immune system during this time? Which I think is a great question. We know that 70% of our immunity, cell immunity, is housed actually in the gut. Small intestine, spleen are very much key players in what helps to keep us healthy. So though I'm not a nutritionist and it's outside of the scope of my practice to advise any specific kinds of diets or guidelines, I can say that most of us have access and ability to look up different kinds of immune boosting activities, foods, exercises, and practices that help keep the immune system strong, as well as all the things we've been told ad nauseum since we were born. Exercise, eat right, get plenty of rest, hydrate. If you like supplements and they seem to be working for you, keep taking them. Eat fresh food, stay away from processed stuff, because you don't need that. And um, or if you find that it's no harm done kinds of things that are calming and soothing. I have here a little show and tell. I've got tea here, so I like a little green tea in my afternoon. Fresh fruit around, and I've got some in the back there. And then for myself, because I have a suppressed immune system, it's a little bit wonky from having autoimmune disease. I happen to be living in a space right now that is only occupied by myself and my cat. I left my husband in the other house because he's working in the public right now. So for me, he thought, and I agreed with him, it was a good idea to just distance for a little while and ride this out. So you do whatever you need to do to boost your immune system. And I think we'll just see as we ride this through what happens next.
Well, thank you so much. Could you just lastly tell us about your business real quick?
Okay, I run one business and another that I consider a project that has a business attached to it. So I run SeattleDirectCounseling.com, which is an all online exclusive counseling practice that I work from my home. I went from having a brick and mortar practice in 2017 for all the years prior until I made a decision to take it all online, noticing that a lot of people would prefer to meet with me in that manner. So we meet by, just like you and I are doing right now virtually, just using a HIPAA compatible platform. And then my second project is myallergyadvocate.com, which is more on the side of helping people figure out how to strengthen, or once they get a diagnosis, to strengthen their immune system, usually through exercise, food, de-stressing, and removing things out of their environment that are causing them harm. And then finding lifestyles that help them just go on and make their lives a lot more fun and more meaningful because they're feeling a lot better. And so that was mostly through food allergies, intolerances, autoimmune disease, and chronic illnesses that require that people make some pretty drastic life changes. For me, that meant going gluten-free and eating an autoimmune protocol diet. That's what worked for me. Also removing all the allergens out of my diet, and then some other lifestyle changes that include how I ended up meeting you, which is I became a triathlete and then ultimately an ultra runner.
Well, thank you so much. I really appreciate your time today. And, so I'll add your information on the bottom of the blog. So if anybody would like to get in touch, they can. Thanks again.
Absolutely. Okay, airwaves from here.
Bye-bye.